This is Jeff Breedlove with the Georgia Council on Substance Abuse here on Giving Tuesday, this very special Giving Tuesday, America responding to the COVID-19 pandemic. I'm joined yet again, and so thankful for her time on this day, by Neil Campbell, the Executive Director of the Georgia Council on Substance Abuse. And we want to talk to you about another one of the core programs that the Georgia Council on Substance Abuse provides for the recovery community across Georgia, and that is Neil's leadership on advocacy for recovery. Neil, you've been not only a leader in Georgia, but you're a national leader on advocacy for recovery. Tell us a little bit about the importance of advocacy and recovery.
Yeah, thanks, Jeff. Thanks for having me again, and hi, everybody. So advocacy is really at the core of what we do, and we define advocacy on three different levels: on a local level, on a statewide level, and a national level. And so when I say we, it's people in recovery and our allies, people that support us. We are always trying to organize and mobilize our voices so that we are at the table when solutions are being looked at for what happens with us in our addiction or with our substance use disorder. So advocacy is a huge part of what the council's been about for 20 years.
And Neil, I know you know better than most. You're at the table one way or the other. You're either the meal or you're serving the meal.
That's right.
You
Yep.
know,
you're on the menu if you're not at the table. So we want to be at the table.
Right, and we want that, not just the recovery voice to be heard, but more importantly, we want the peer voice in recovery to be heard.
That's right, and we think that there should be nothing about us without us. That we feel that for many and many years, people would look at us and say, look what's wrong with them. And what happens is our behavior tends to get criminalized, or we get marginalized, and there's a huge amount of stigma. And the only way to reduce stigma is to educate people and to let them know that we are in recovery, we vote, we are an important constituency that wants to direct our care, direct what's going on with us and our families and our loved ones and others who may struggle with substance use disorders or mental health conditions.
Well, we could talk for hours about different parts of advocacy, particulars at those three levels you referenced, but we did want to highlight three particular issues, if you will, to give an example for the viewers as to what we're talking about. One is a word that is used. It's a piece of legislation that's actually already been passed, and people may not know the word, but they sure know what's behind it. And I would like you to educate folks about the word parity.
Yeah, so parity was there's a Mental Health Substance Use Disorder Parity Act that was passed 12 years ago, if my math is right, which it might not be, but it was back in 2008, the Wellstone-Domenici Act passed. And what it basically said was that there should be equal treatment of mental health conditions and substance use disorders in insurance plans. In other words, if heart disease is covered in an unlimited way by an insurance plan, a substance use disorder should be covered unlimited as well. Because what used to happen was that mental health conditions and substance use disorders were treated as sort of in a boutique way, and you often had to meet standards that were high above what you would for any other health condition. So this was a level the playing field. Now, parity has not been implemented by private insurance plans for a number of reasons. One is the bureaucracy. It took 5 years to get the rules written for parity. And then each state has to define that for themselves. And so it's just been really slow in coming, and we're going to put that on the front burner this coming year.
That's wonderful, because some people might say that's just blatant discrimination.
Right.
I mean, that's what it is. It's a civil rights issue here in 2020 and 2021 that has to be dealt with. And at your direction, the Georgia Council is partnering with a coalition of great organizations around the state to get ready here in 2020 to really make this an issue in the 2021 General Assembly.
Yep, and we often say, Jeff, as you know, that it's really important we just don't want our allies to be at the table. We, as people in recovery, want to be at the table because we think we are the evidence that this works. If you give us an opportunity to get well, give us what we need, our self-directed care, then we will get well.
And another part of advocacy is, and it's a word that a lot of people don't like, but we call it appropriations in government, but it means funding. and that funding is taxpayer dollars, but that's what makes it relevant to us, because good intentioned legislators can go pass all the good laws they want. But a key of that is when a law is passed and the regulations are implemented, that it not just be about recovery, but again, that the peer voice, the people in recovery have a say in the implementation of those rules, laws, and regulations.
That's right. And we are constantly advocating for having peer-run organizations be at front and center. Like 2 years ago in 2018, the Georgia General Assembly gave us didn't give us anything, but they appropriated $4 million. And from that $4 million, we've gotten 16 local recovery community organizations that are run by people like us, Jeff, like people in recovery. And we have served tens of thousands of people in that amount of time. We stood up these programs very quickly because the recovery community responds. And so we want folks to recognize the power that we have, the ability to listen to our communities, to be valuable in our communities. And that is directly related to funding. And as you know, you and I are a bit concerned about the budget coming up this year because of COVID. And which is one of the reasons we're making this appeal, but we also have confidence that people are going to listen to recovery in big ways.
Oh, absolutely. And a third example, and again, if you think about this, if a viewer out there just tuning in, you might say, well, what does that matter? But I think Neil's going to share with us why it matters. But State Representative Eric Allen is working with a group of legislators to have for vote in the 2021 session a official Georgia license plate, just like you see all these special vanity plates, that's called the Georgia Recovers plate, and it supports recovery both for a substance use disorder and mental health. Neil, tell us why that's important.
I think visibility is huge. Representation matters. If there's anything that our politics has told us over the last 10 years, is that who we see matters. And if we see, like the sign behind you, the logo, the Georgia Recovers logo, in the billboard project we had this past year, that matters. Seeing someone, I wish in early recovery 30 years ago, I saw someone like you or like me that got through it, because I didn't think I was going to get through it. So representation really does matter. And I know I used to think license plates were kind of trite, even though I do have some specialty license plates on our vehicles, my family vehicles. I think it's really important. If you look at a wildflower and you say, oh, hey, part of my hard-earned dollars is going towards something I care about. Wouldn't it be great that we could have funding going toward mental health and addiction recovery? That to me would say a lot. And I always talk about changing social norms and how we have to start thinking about people like us differently. The only way we're going to do that is with visibility and representation.
Exactly. So look for that legislation to move forward and 2021, and stay tuned for that. And speaking of legislation, a historic occurrence happened in this current suspended session. At your direction, Neil, the Georgia Council began working with members of the General Assembly, not the least of which is a great recovery champion, Representative Eric Allen, and Senator Randy Robertson. These two gentlemen, one in the Senate, one in the House, one Republican, one Democrat, one white, one African American, seemingly would have nothing in common, but they are friends and they have a love and support of recovery in common. And working with the leadership down there, the governor, lieutenant governor, and speaker, they have formed an official working group called the Working Group on Addiction and Recovery. It is over 30 members strong, bipartisan, bicameral, meaning both the Senate and the House. And Neil, it's never happened in the state of Georgia before.
Yeah, it was really important, Jeff, and I give you all the credit in the world about having that vision. When you told me it could be bicameral and bipartisan, I thought, oh no, we'll never get same people in the same, people in the same room from different parties and different houses. But we did, you did, and so that it's really a significant move. And what we would love to see as advocates is any type of policy that gets passed or gets even considered should be run through this recovery caucus. Is it good for recovery? Does it promote wellness? Does it help people get better? Or is it promoting stigma? Is it promoting incarceration? Is it promoting racial disparities? All of that stuff we want to be able to make sure that we are having an impact on. So I think this particular working group could be, not only can it be revolutionary in terms of it's never happened before, having policy. I mean, that's where I get excited. I'm kind of that kind of wonk. I get really excited about legislation that gets passed that actually helps people in recovery and that gets pushed through that sieve. And I would love to see that happen to every piece of legislation.
Well, we are thankful to everybody that may still be watching, because Neil Campbell and Jeffrey love to talk about government and policy for hours. But that's not the point today. Today, we are here because it's Giving Tuesday. It's a special Giving Tuesday across the nation, America uniting in response to COVID-19 in support of nonprofits. We're so privileged and proud to be one of the nonprofits participating. And we know times are tough, but if you're in a position to make a donation, every donation counts from $1 up. Whatever you're in a position to give, it goes to support all the wonderful programs at the Georgia Council on Substance Abuse, including the work we do in advocacy to support the peer community of recovery across our state. And we just ask for your consideration. Neil, thank you so much for being here.
My pleasure. Thank you, Jeff. Thanks for everything you're doing.
Thank you, Neil. And as we always say, recovery is
Recovery's real.